guys, Dr. Lowry here at Lowry Chiropractic and Wellness Care. Today I wanted to hop on and talk about neuroplasticity. What neuroplasticity is the ability for the brain to develop throughout one's life. So to accommodate and make the changes as we grow and develop. This can happen emotionally, this can happen cognitively as far as brain processing, this can happen mechanically and structurally as far as how we move and what we do. So a lot of times people don't understand what the goal of rehab is or what chiropractic care is. So that's what I want to talk about today. So when we perform rehab, our goal is not just to strengthen a muscle or anything like that. It's actually to change your neurological function of that muscle. It's to change a motion pattern. So what do I mean by that? Say I have somebody with 5 years of chronic low back pain, okay? They're hunched over like this, they lean forward, and they're afraid to move. They've strengthened all the central nervous system's connections to be in this position, to fire these muscles, to avoid these positions, and they've adapted a fear mentality to motion. So what our goal with treatment is to take the body, deliver an adjustment, or put an impulse into two motion segments to help them move better, to relay to the brain and say, hey, this area actually can move, it's okay for you to do that. Then our goal is to take different muscle groups that haven't been working and train them neurologically to function better. So what do I mean by that? If I'm stuck like this and every time I go to stand up, I use the extensor muscles here in my low back, I'm strengthening the neural connection between my brain and these muscles, and I'm constantly training that movement pattern. The problem is that's actually detrimental. My goal should be to train my glutes to pick me up from that position and decrease the stress in the low back. So with training, we use things like goading, touching that muscle, activating it, putting a stimulus there that tells the brain, hey, there's a muscle here, and then we can retrain that muscle to develop the brain. So everyone always thinks like, oh, we just need to strengthen the muscle to get it to work better. That's not always true. Sometimes it's actually just being able to fire that muscle and knowing when to use it or how to use it. We call these movement patterns. Are you able to perform a series of motions correctly, firing the correct muscles? So when we go through and we're trying to get you out of back pain or out of neck pain, depending on what it may be, we actually re-educate movement patterns to teach you the correct way to do something so that cognitively you are in control of that motion. I hope that explains neuroplasticity pretty well. If you have any questions, please feel free to comment or give the office a call or send me an email. Thanks, guys.